Hi, my name is Emmanuel Cruz Carrasco. I'm going to read chapters 5 and 6 of the textbook Professional English Used in Medicine. Chapter 5 is about medical practitioners 1, and chapter 6 is about medical practitioners 2. I'm going to begin reading chapter 5, medical practitioners 1. A. Practitioners. In Britain, doctors, also known as medical practitioners, must be qualified, have a university degree in medicine. They must also be registered, included in the General Medical Council list, or registered in order to practice. We can see more in the Unit 13. A doctor who treats patients, as opposed to one who only does research, is called a clinician. A doctor who provides primary care for patients is known as a general practitioner or GP, or family doctor. GPs usually work in a group practice. Larger group practices work in a building called a health center. Note, in British English, the verb is spelled practice and the noun is spelled practice. B. Specialties. Specialist doctors, for example, pediatricians, generally work in hospitals. However, those who work outside the NHS or National Health Service, providing private healthcare, may have consulting rooms outside a hospital, for example, in the famous Harley Street in London. The two main branches of medicine are surgery and internal medicine, and the doctors who practice these branches are called surgeons and physicians, respectively. In Britain, male surgeons are addressed as Mr. and females as Miss. So Dr. Smith is a physician, and Miss Smith is a surgeon. Now I'm going to read a small box with specialties. A cardiologist, a geriatrician, an anesthetist. Specializes in is a specialist in. A cardiologist specializes in diseases of the heart and circulation, or cardiology. A geriatrician is a specialist in diseases of elderly patients, or geriatrics. An anesthetist is a specialist in anesthetics. Or with an anesthetist, we talk about a person who knows how to the dosage of anesthetic that a patient must be injected, that is safe for his health and his condition. Note, names of specialties usually end in ology. Names of specialists usually end in ologist. If the name of a specialty ends in EAS, the name of the specialist ends in ECEN. There are some exceptions. For example, anesthetics and anesthetist. C. Choosing a specialty. Jill Matthews has just graduated from medical school and is talking about her future. I haven't decided what to specialize in yet. I need more experience before I decide, but I'm quite attracted to the idea of pediatrics because I like working with children. I would certainly prefer to work with children than, say, elderly patients, so I don't fancy geriatrics. I was never very interested in detailed anatomy, so the surgical specialties like neurosurgery don't really appeal. You have to be good with your hands, which I don't think is a problem for me. I have assisted out operations several times, and I have done some minor ops by myself. But surgeons have to be able to do the same thing again and again without getting bored, like tying off cut arteries and so on. I don't think that will be a problem for me, but they need to make decisions fast, and I'm not too good at that. I like to have time to think. which means surgery is probably not right for me. Note, the collocation with good with is followed by a noun. He's good with children. The collocation good at is followed by the ing form gerund of a verb or by a noun. She's good at explaining procedures. She's good at explanations. Now I'm going to read the exercises of chapter 5, Medical Practitioners 1. Word 5.1. Write sentences to describe the work of the specialist in each branch of medicine. Look at B opposite to help you. 1. Dermatology. A dermatologist specializes in diseases of the skin. 2. Rheumatology. A rheumatologist specializes in musculoskeletal diseases and autoimmune and systemic autoimmune conditions. 3. Traumatology. A traumatologist specializes in treating acute, severe, and acute physical injuries. 4. A pediatrician specializes in the treatment of children. 5. Obstetrics. A obstetrician specializes in the treatment of pregnant women or people under deliverance of and childbirth. 5.2. Complete the table with words from A, B, and C opposite and related forms. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Verb, specialize. Verb, practice. Verb, consult. Verb, assist. Verb, graduate. Verb, qualify. Noun, person. Specialist. Noun, person. Practitioner. Noun, person. Consultant. Noun, person. Assistant. Noun, person. Graduate. Noun, person. Qualifier. Noun, activity or thing. Specialty. Noun, activity or thing. Practice. Noun, activity or thing. Consultancy. Noun, activity or thing. Assistance. Noun, activity or thing. Graduation. Noun, activity or thing. Qualification. 5.3. Find prepositions in C opposite that can be used to make word combinations with the word in the box. Then use the correct forms of the words to complete the sentences. Good. The words in the box are good, interested, specialized, and work. 1. A pathologist specializes in diagnosing disease through examining cells and tissue. 2. A pediatrician must enjoy working with children. 3. An oncologist is a specialist in the diagnosis and treatment of cancer. 4. A psychiatrist must be interested in counseling. 5. A neurosurgeon must be good with her hands. 5.4. Make word combinations using a word from each box. 2 words can be used twice. Look at A, B, and C opposite to help you. The words in the boxes are consulting, general, group, health, internal, surgical in the first box. In the second box are center, practice, specialties, medicine, practitioner, and rooms. The combined words are general practitioner, internal medicine, surgical specialties, health center, consulting rooms, and group practice. Now I'm going to read Chapter 6, Medical Practitioners 2. A. Hospital staff. The people who work in any type of workplace, including hospitals, are called the staff. The medical staff in a British hospital belong to one of 4 main groups. A pre-station house officer, PRHO, or house officer, is a newly graduated doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner. In the current system of training, the foundation program, the name for these junior doctors is Foundation Year 1 Doctor, FY1. You can see more information about this in the Unit 12. The others are a senior house officer, HO, is in the second year of postgraduate training. The title is now Foundation Year 2 Doctor, FY2, but the old term Senior House Officer and SHO are still used. A specialist registrar, SPR, is a doctor who has completed the foundation program and is training in one of the medical specialties. There are also some non-training registrars, doctors who have completed their training who do not wish to specialize yet. A consultant is a fully qualified specialist. There may also be some associate specialists, senior doctors who do not wish to become consultants. In addition, there is at least one medical or clinical director who is responsible for all of the medical staff. B. Medical teams. Consultant physicians and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams, which consist not only of doctors but also of physiotherapists and other allied health professionals. We can see more about this in the Unit 8. When patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors on the ward where they will receive treatment and care. The junior doctor clears them, takes their medical history. You can see Units 47 through 48 and 49 for more information about this, and examines them. Sometime later, the registrar also sees the patients and may order investigations or tests, for example, x-rays or ECG, make a provisional diagnosis, and begin treatment. The consultant usually sees the new admissions, people who have recently been admitted to the ward for the first time on one of the regular ward rounds, when the management of the patient is discussed with the registrar. Consultants also decide when a patient is ready to be discharged, sent home. On the ward round, the consultant is accompanied by the team and nurse, and they visit all the patients in the consultant's care. C. Shifts. Junior doctors now normally work in shifts, which means they normally work for 8 hours every day, for example 7 a.m. to 3 p.m., and are then free until 7 a.m. the next day. After a week, they change to a different shift, for example 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is work from 9 a.m. to 5 p.m. Every day, and to take turns to be on call, available to return to hospital if necessary, from 5 p.m. to 9 a.m. the next day. Days on call are set out in a rota or list of names and times. Doctors on call carry a radio pager or bleeper, a device which makes a noise when someone is trying to contact them. Now I'm going to read the exercises of Chapter 6, Medical Practitioners 2. 6.1. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. The words in the boxes are, in the first box are associate, house, own, provisional, radio, ward. In the second box are call, diagnosis, officer, pager, round, and specialist. Now I'm going to read the word combinations. Associate specialist, provisional diagnosis, ward round, radio pager, house officer, on call. 6.2. Match the descriptions 1 through 5 with the jobs titles A through E. Look at A and B opposite to help you. 1. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to Ward 60. 1 is C, so Dr. Graham is a consultant. 2. Dr. Stewart has just started the second year of the foundation program. Dr. Stewart, 2, is D. He is a senior house officer or SHO. 3. Dr. Singh has started his training as a surgeon. 3. Dr. Singh is a specialist registrar. 4. Dr. Phillips has just graduated and is working in a large hospital in Birmingham. 4. Dr. Phillips is a PRHO or prioritization house officer or house officer. 5. Dr. Miller is in charge of the medical staff in the Birmingham hospital. 5. Dr. Miller is a medical director? 6.3. Are the following statements true or false? Find reasons for your answers in A, B, and C opposite. 1. A medical graduate becomes registered 2 years after graduation. This is true. This is because of the foundation program. 2. The system of training doctors in Britain is called the foundation program. Yes, this is true. 3. The name senior house officer is no longer used in Britain. This is false because the new name is Foundation Year Doctor 2, but the name senior house officer or SHO is still used. So the 3 is false. 4. The consultant is usually the first doctor to see new patients. This information is false. The first person to see the patient is the junior doctor or the foundation year 1 the postgraduate. So this is false. The consultant works with the patients at a later date. So the 4 is false. 5. When working in shifts, all doctors take turns to be on call. This information is false because there are 2 modalities, one with different times, one standard that is from 9 to 5 or from 5 to 9. But it depends. But this sentence 5 is false. 6.4. Complete the text of a PRHO or Prejudice Station House Officer describing her job. Look at A, B, and C opposite to help you. When I get to the ward, the first thing I do is talk to the house officer who was on duty during the last shift to find out if there have been any new admissions. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down. Later in the morning, I clerk any new patients, which basically involves taking a history. On Tuesday and Friday morning, the consultant does her ward rounds, and I have to make sure I'm completely up to date on her patients. After that, there are usually lots of things to do, like writing up request forms for blood tests, and so on. In the afternoon, I have to prepare for any patients who are to be discharged the next day. They are usually happy to be going home. And then, of course, there are the lectures and tutorials in the foundation program on Monday and Wednesday. So those were chapters 5 and 6 of the textbook Professional English Used in Medicine, Medical Practitioners 1 and Medical Practitioners 2. So that was the video. Thank you very much for watching.